Hello, I'm going to be talking about how to insert an indwelling catheter to a female patient today. So the first thing you want to do when you're putting in a catheter is you want to introduce yourself. So hi, I'm student nurse Christine and I'm going to be looking after you today. You want to provide patient privacy by closing the curtain, perform hand hygiene, and then you want to verify the client. So ask them to state their name and then double check with their armband to make sure that you're working with the same client. And also make sure that they're alert and oriented ×3. And so you're going to explain why you're there. So you're going to tell them that their healthcare provider has ordered an indwelling catheter and that you're going to be putting it in today. And you're going to explain the procedure to them, take into account any cultural considerations, and also ask them if they have any allergies, especially to latex. So next you're going to palpate the bladder for any distension, and you're going to ask if they feel any discomfort or pain. And then you're going to leave them for a moment and tell them that you're going to go collect the supplies you need to insert the catheter. So you want to make sure you get the right size and type of catheter as well. So after you tell them you're going to leave for a moment, come back, you have your kit. So I already have it set up here. You're going to perform hand hygiene, raise the bed to working height, and lower the handrail. You're then going to provide patient privacy by putting a drape over them, just so that only their perineal area is exposed. And then you want to put them in a dorso-recumbent position. So have their knees flexed and their thighs relaxed. So just making sure only that area is exposed so that they don't feel too uncomfortable. So next you're going to apply clean gloves. So pretend I'm putting on clean gloves here. And you need to clean their perineal area to begin with. So working from the front to the back, cleaning that whole area and then drying it completely before inserting the catheter. So after you clean them and you still have your gloves on, you want to identify the urinary meatus. And if you are having a hard time with this, then you can ask for help if you need to. So then you're going to remove your gloves. And you're going to open your catheter kit on a clean surface like I have done here. So you're going to create a sterile field, and all the supplies that you need to insert a catheter are going to be in this kit. So you kind of just follow how it's laid out. So you're going to start by placing the sterile drape between the client's thighs, so on the bed here. So just pretend this is between their legs, because that's the surface you're going to be working on when inserting the catheter. And then next there's going to be sterile gloves here, so you're going to be putting on those sterile gloves. And then there's also another drape that you're going to put on the client that just exposes their perineal area and provides a clean surface around that area. So after you put that on, next you're going to take the tray. So I have my sterile gloves on. You're going to take the tray and you're going to put it on that sterile drape that's between the client's thighs, because this is where you're going to be, this is where all your supplies are and where you're going to be inserting the catheter. So then next you're going to open the lube and squeeze it onto the sterile field. So again, that's in the kit here. And then you're also going to open the antiseptic solution and place it on the cotton balls. So you're going to be using this to clean the area before you insert the catheter. So after you put it on the cotton balls, you're going to open the catheter. So that is already done here. So it's already open, and you're going to place the end of the catheter into the gel, 1 to 2 inches, just like that. And you're going to leave it there until you're ready to use it. So after you've put it in the gel, you're going to use your non-dominant hand, and you're going to open the client's labia. And you want to keep this open throughout the whole procedure, because if it closes, then that area is contaminated and you need to redo it again. So you're going to open the client's labia, and then you're going to use the forceps and the cotton swabs, and you're going to grab a cotton swab and you're just going to clean the area, discarding and using a new cotton swab every time. So keeping that labia open after you've cleansed the area 3 times, down the outer side, inner side, and then down the middle with 3 different cotton swabs. You're going to discard of those, and then you're going to grab the catheter 3 to 4 inches from the tip, and you're going to insert that into the patient until urine appears. And then after you see urine, you're going to put it in a little bit further, 1 to 2 more inches. So after that is inserted into the female patient there, you can release the labia, and you're going to switch hands and grab the tubing with your non-dominant hand. And with your dominant hand, you're going to grab the pre-filled syringe of the sterile solution, and you're going to attach that into the injection port on the catheter, and you're going to fill the balloon with the full amount of the liquid there. So after you have done that, you can take off the syringe, discard of that, and then you're going to pull back gently on the catheter until you feel some resistance, and then you know that it's set in place properly. So after you've tugged on the catheter a little bit and made sure it's in place properly, you can remove your sterile gloves. So the catheter is in place. Remove your sterile gloves, and then you're just going to put on another pair of clean gloves, and you're going to secure the catheter to the thigh. So sometimes they have a little sticky pad or a thigh strap that you can use to hook it on there. And you just want to make sure that there's enough room so that the catheter won't tug when the patient moves around. And then you're going to attach it to the drainage bag, and you're going to hook the drainage bag onto the bed frame and coil any extra tubing onto the bed there so it's out of the way. So you've inserted the catheter. Now you're just going to dispose of all your supplies into the proper receptacle, and you're just going to ask the client if they're feeling any discomfort or pain. And you're just going to document the whole procedure, including the amount of fluid that has been inserted into the balloon. That's very important. And just noting any complications, how the patient tolerated the procedure. And follow-up care would include gathering urine output and noting the characteristics of the urine. So after your patient's after you've done that, you're going to lower the bed rail, or lower the bed, raise the handrail, make sure they're in a comfortable position. And leave the call bell there for them, and ask them if there's anything else they need before you leave. Perform hand hygiene, and then you're done.